Should antidepressants be used as a standard intervention for the treatment of depression in people with cancer? This presentation will discuss why the topic was chosen, depression in cancer patients and signs and symptoms of depression in cancer patients, the prevalence of depression in cancer patients, the classes of antidepressant drugs that were trialled, the evidence, including data gathering, study selection and the NHMRC evidence classes, the reported outcomes and lessons learned. The topic was chosen due to personal and clinical experience. In a number of cases, the diagnosis of depression commenced later in the treatment. However, the signs and symptoms were evident much earlier. What is depression? Being depressed is much more intense than feeling down or sad, as we all do from time to time. However, feeling sad now and then is part of life, but depression is a much stronger feeling than sadness. It is often harder to bear and can affect your ability to cope with everyday things such as eating, sleeping, normal hygiene, engaging in social activities and work. Depression is a medical illness like having a broken leg or a heart condition. It needs treatment. If you are depressed, you can't simply just get over it, and this can be difficult for people around you to understand. Unless someone has been depressed themselves, it is almost impossible for them to understand how it feels. This slide shows the signs and symptoms of major depression. Of depression in cancer patients has been challenging because symptoms occur on a spectrum that ranges from sadness to major affective disorder, and mood change is often difficult to evaluate when a patient is confronted by repeated threats to life, is receiving cancer treatments, or is fatigued and experiences pain. Depression is said to be the least recognised symptom in people with cancer. The signs or symptoms of depression in people that have been diagnosed with cancer are loss of interest in pleasures or hobbies, and decreased energy, fatigue and a sense of being slowed down, difficulty concentrating, remembering and making decisions, insomnia or oversleeping, increased weight changes, loss of appetite, thoughts of death or suicide, or even suicide attempts, restlessness and irritability. These are all signs and symptoms of a major depressive order. So as you can see, the signs and symptoms do overlap. Even though depression is a common complaint amongst cancer patients, it isn't always diagnosed. The signs of depression are often confused with the symptoms of cancer itself. It is believed that it affects approximately 15 to 25% of cancer patients. It affects men and women with cancer equally. And the pooled mean prevalence of depression in cancer patients ranges from 8% to 24%. There are a number of types of antidepressants, as you can see in this slide, with 5 main groups. Only 2 of the groups, the tricyclics and the SSRIs, were covered in the research. Tricyclics are known as the first generation antidepressants, and SSRIs are known as a second generation antidepressant. The tricyclics were effective, but have generally been replaced by antidepressants that cause fewer side effects, those being the SSRIs. Tricyclic antidepressants ease depression by affecting naturally occurring chemical messengers, neurotransmitters, which are used to communicate between brain cells. SSRIs are now the most commonly prescribed antidepressant. They also work by affecting the naturally occurring chemical messengers, which are used to communicate between brain cells. SSRIs block the reabsorption or reuptake of the neurotransmitter serotonin in the brain. Changing the balance of the serotonin seems to help the brain cells send and receive chemical messages, which in turn boosts mood. I undertook an initial search for these articles in the Cochrane Library. The Cochrane Library is a collection of 6 databases that contain different types of high-quality, independent evidence to inform healthcare decision-making, and a 7th database that provides information about Cochrane groups. I used antidepressants in the treatment of depression with cancer. I then used Antidepressants, Cancer and Systematic Review to open up the search. I then used the library search tool to find the full text articles using eLibrary so I could download the articles in full text. Using the abstracts, I checked the articles were systematic reviews and a meta-analysis had been undertaken. The NHMRC is Australia's leading expert body for supporting health and medical research, developing health advice for the Australian community, health professionals and governments, providing advice on ethical behaviour in healthcare and in the conduct of health and medical research. Their mission statement is working to build a healthy Australia. The 3 articles chosen were all Level 1 evidence, being systematic reviews and meta-analysis. The NHMRC outlines how an individual study included in a systematic literature review should be assessed. To be a Level 1, there must be a systematic review of Level 2 studies, which is a randomised controlled trial. The first article, Antidepressants for the Treatment of Depression in People with Cancer by Ostuzzi et al., 2015, analysed 9 different studies. It was limited by a lack of reliable studies and limited by a lack of trial consistency. A second article, Re-evaluating the Role of Antidepressants in Cancer-Related Depression, a systematic review and a meta-analysis. The study was also a Level 1. Was current in 2014, analysed 9 different studies, but again was limited by a lack of reliable studies. The third article, Antidepressants in the Treatment of Depression, Depressive Symptoms in Cancer Patients, a systematic review and meta-analysis by Lautidis, was current in 2013 and again analysed 9 different studies. 83% were women and was also limited by a lack of reliable studies. The overall sources of bias included comorbidity factors, which can compromise the purity of the trial leading to bias in the results, inconsistent study selection, which could have led to study bias. Some of the trials were funded by pharmaceutical companies, and studies were generally small in size. There was also inconsistent data on the inclusion of non-pharmacological interventions during the studies. Australia 2015 showed a clear beneficial effect of the antidepressant mianserin over the placebo, which affected the final result of the meta-analysis. The mianserin studies had a relevant impact on the overall results. The Riblet 2014 found several antidepressants were generally effective, including mianserin and 2 of the SSRIs. Evidence for the efficacy of other antidepressants in cancer-related depression was lacking. The Lautidis study found that antidepressants are an effective treatment of depression and depressive symptoms in cancer patients. It also found that mianserin in comparison to SSRIs in a subgroup analysis did not support a recommendation for one antidepressant type over another. From these studies, I concluded that the available research was quite limited. However, the study methodology was not. There was a limited range of antidepressants used in the studies, as not all classes of antidepressants were included, and the benefits and the use of psychotherapy was not included in all trials.